With more than 20 million Americans out of work in April alone, the job search process is changing, and so is the workplace. NBC News consumer and investigative correspondent Vicky Nguyen shows us what offices might look like when they reopen.
Monster.com says the jobs in highest demand now include frontline healthcare workers, truck drivers, and software developers. The top searches by job seekers are work from home, healthcare, and warehouse worker.
What can we be doing with our time now that can prepare us for the jobs of the future?
Right now, people can be learning. Ramp up your skill set in terms of what you're learning online, what you're consuming. Take an online class.
Monster career expert Vicky Salemi says take this time to make multiple resumes to showcase different skills and network.
Reach out to a former boss, former colleagues, get in touch and maintain and build those relationships right now.
If you are working from home, a recent survey shows more than half of employers are willing to re-examine their policies based on staff productivity during the pandemic.
As of today, restaurants, retail, and gyms have the ability to open in limited capacity.
Those returning to work can expect new cleaning procedures, less business travel, and possibly even health scans before workers can enter a building.
Now we're going to calculate your body temperature.
And check out the 6 feet office concept by Cushman and Wakefield. From carpet designed to mark social distancing to disposable desk pads that help keep shared spaces clean. The plan also calls for barriers like these between employees at their desks. And arrows on the floor directing people which way to walk to minimize the chances of bumping into each other.
I can already see after 2 weeks of testing that people really appreciate to feel safe, to be back at work and to enjoy your colleagues, to just laugh and have fun and look each other in the eye.
Workers should also be prepared for health screenings. A new report from Columbia University calls for healthcare, restaurant, and public transit workers to be rapid tested for COVID-19 before each shift.
Would you be willing to submit to a saliva or a nasal swab before your shift?
Oh, without question. I mean, it would be ridiculous if you didn't.
Dr. Irwin Redlener co-authored the report with fellow NBC News contributor and virologist Joseph Fair.
We cannot undermine the necessary things that need to be in place in order to go back to work safely.
And Vicky joins us now. Vicky, we just saw what the future of the workplace might look like. How big of a financial impact will these changes have on companies? I can't imagine it's inexpensive to do all of this.
Yeah, listen, it really depends on what kinds of changes these businesses want to implement. But to give you an idea, you saw the 6 feet office plan. That would cost a business about a month's rent in whatever building that they're in to implement a solution like that. The device that we walked through, that symptom sense, yep, you see it right there. They're saying those are going to go for $35,000 a piece. So this is not inexpensive, but there are things businesses can do that aren't as expensive, like adding hand sanitizer or staggering their employees' work schedules.
What about small businesses, Vicky? What kind of changes are they looking at? I imagine their budgets are very different and they may have to make different adjustments.
Smaller businesses really have to be resourceful, Allison. We talked with an epidemiologist who said number one is situational awareness. Pay attention to what's happening in your county, in your city, in your town. Is it a place where you're seeing coronavirus cases spike? Well, then you ought to be taking maximum precautions to protect your customers and your employees. Perhaps the worst of it is over where you live, but you still want to follow CDC guidelines of having everyone cover their nose and their mouth when they come in, or putting up simple signs that just remind people to socially distance, maybe rearranging your business so that people are less likely to come into contact with each other when they're inside. Of course, limiting capacity. There are certainly things businesses can do that don't cost money, but that will protect their workers and their customers.
Yeah, so many small things that can make such a big difference. Vicky Nguyen, thanks so much for being with us. Have a great weekend.
You too, Allison.
It's Friday and you might be thinking about unwinding with a cocktail. All right, fair. It's a pandemic. You're probably thinking about cocktails every day of the week. Some local businesses and lawmakers are working on getting you that mixed drink to go with so many bars and restaurants closed for dine-in service. NBC News legal analyst Danny Savalos joins me now. And Danny, there is an initiative in Illinois that's getting some traction. What are they pushing for there?
Ironically enough, Illinois has some movement to get takeout to go alcohol drinks, cocktails. Why this is pretty paradoxical is that Illinois was the first place that open intoxicant laws originated in about the 1950s, some 20 years after Prohibition was repealed. So it's ironic that now Illinois is the one pushing to allow people to drink on the street when they were the originators of getting people who were drinking off the street and making it illegal. As it stands today, the country is a complete patchwork quilt of open intoxicant laws. They run the gamut all over the place. So it really depends on what each locality wants to do, unless the state has prohibited it at the statewide level.
Danny, incredible how times have changed there in Illinois. As you mentioned, some states already doing cocktails to go. I know New York is one of them. How are different states loosening their liquor laws?
They're doing it a number of different ways, Allison. I don't know if you can see what I have here today. Yeah, so they're doing it in a number of different ways.
What do you got there, my friend?
Take them out. Well, this is, you know, my mother-in-law starts drinking at like 11 a.m., so she's mixing these early, but I asked her to just make me one with lemonade. That's all I'm looking to do. But I figure it looks like appropriate for the hit. So anyway, getting back to serious business, Allison, the different states and localities are opening these up so that people can go to bars and go to restaurants and possibly pick up to-go alcohol and even have it delivered to them in to-go containers. Because after all, it's one thing to order a can of beer. It's a whole other thing to order a fuzzy navel or a strawberry daiquiri by delivery or to go. And the challenge is coming up with a container that is satisfactory, at least to the government, who wants to make sure that at least these intoxicants aren't openly emblazoned or shown off in the streets, and it becomes a big party.
Danny, do you expect that more states will change their laws to let it flow to go, if you will?
Likely they will. The longer this continues, this ban, you're going to see states open up these laws and relax them so that people, at least these restaurants, can have more of a fighting chance to stay alive. I mean, you've seen a lot of restaurants make the transition very well from dining in to ordering out and bringing food out to your car and delivery and all kinds of other things. And any restaurant will tell you having a liquor license, if they have one, is a major source of revenue, a huge source of revenue. And liquor licenses can often be very expensive, so they have to pay for that license. So the option of actually having alcohol to go allows them to claw back some of that lost revenue and actually start making money again. And really, a restaurant that has a decent takeout business and an alcohol to go business could almost get back to pre-pandemic sales.
Yeah, Danny, I know we've been joking about being able to get cocktails to go. I mean, but you bring up a great point. I've discussed this, talked with my husband a million times and said, look, I'm not joking here. It is so important that these businesses can sell the booze again. The margins on the alcohol are so much better than the margins on the takeout. You lose that, and some of these businesses can't keep going.
They're huge. And so without these restaurants without them getting that revenue from their very expensive liquor license, their very business could be jeopardized. And states know this. I mean, it's not really about, a big cocktail party and everybody getting their booze. I mean, this is a business. Right. Alcohol is a legal intoxicant, and people make it part of their going out experience. All those restaurants that are now doing takeout are completely losing that because people aren't necessarily going to order, or at least they weren't allowed to order takeout alcohol. Now that, and if they did, it was usually beer or maybe even wine, but not, usually it's going to be something in a can that can be transported. So this opens up a whole new area of revenue that restaurants and bars could potentially take advantage of. But the challenge is that there is no federal guidance there's no federal law like there was with Prohibition back many, many years ago. This is something that is state by state and locality by locality. So these states will all be the laboratories of this new law, and we'll see exactly what they do.
Yeah. Yeah, I mean, Danny, even just anecdotally, I have to say, the businesses that had signs in their windows saying we've got margaritas to go always appear to be a little bit more crowded with people waiting for takeout than the ones who don't. I have to ask, what happens once the coronavirus pandemic is over? Is this something that might stick around? Asking for a friend here.
That is really interesting because one old rule of law is that when you giveth rights, it is really difficult to taketh those rights away. Once consumers and Americans get used to the idea of walking up to a takeout window and ordering their alcohol, and those folks who I think they've been to New Orleans, maybe have seen that in one of the few localities that allows walking around with your alcohol, they may, once they get a taste of it, so to speak, they may not want to quit. On the other hand, maybe a lot of people, say in New York, who have been locked up in their studio apartments, are really, really looking forward to getting together in a bar or restaurant with other folks and being in the same place together, and not just going on a walk through Central Park with their alcohol to go cup. So we're looking at a real cultural change, and the law usually follows cultural change. So we'll see what happens in the future.
Very curious to see, but Danny, I can't say I hate the option. Cheers to you, my friend, and cheers to your mother-in-law. She sounds like my kind of girl. Very, very impressed with the cocktails.
Oh, she's a blast. The problem is she's a blast at like 10:30 in the morning. That's the challenge. So
I love it. Danny, my best to you and your family. Have a great weekend. Hey everyone, I'm Allison Morris. You are watching NBC News Now. Let's head on over to NBC News Now correspondent Alexa Lioto. She is following the very latest coronavirus headlines for us from NBCnews.com. Alexa, Headlines Friday edition. Take it away.
Hey, Allison. So we're starting first with some news on the U.S. economy. The unemployment rate has surged to 14.7% after losing 20.5 million jobs in April. In a statement, House Speaker Nancy Pelosi called for an additional relief package that includes, quote, testing, tracing, and treatment to safely reopen the country. Now, the vice president's top spokesperson, Katie Miller, has confirmed to NBC News that she has tested positive for coronavirus. She says she tested negative yesterday, but positive today and is asymptomatic. She is also the wife of Stephen Miller, a top advisor to the president. This, of course, comes just a day after a valet for President Trump, who worked in the West Wing, also tested positive for coronavirus. Now from New York, 2 New York children have now died from a rare illness linked to coronavirus. New York now has at least 73 children presenting symptoms of pediatric multisystem inflammatory syndrome. Here's Governor Cuomo.
This is every parent's nightmare, right? That your child may actually be affected by this virus. But it's something we have to consider seriously now.
The U.S. Postal Service announcing today that its losses have doubled as the coronavirus pandemic hammers the economy and mail volume declines. The USPS today said it lost $4.5 billion in the quarter ending in March, more than double its losses during the same quarter last year. In a press release, USPS said it expects significant impacts over the next 18 months, quote, threatening the Postal Service's ability to operate. Now from NBC's Catherine Prosiv, a once-in-a-generation May snowstorm is heading towards the Northeast and New England this weekend. Residents who may have wanted to enjoy some pre-summer sunshine are now potentially facing freezing temperatures. It'll likely be heavy, wet snow, which could ultimately lead to power outages. And those are the latest headlines for this hour, keeping you informed at home. Allison, back to you.
All right, Alexa, thank you so much. And you can visit our live blog. That's nbcnews.com/coronavirus for the very latest updates anytime.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.